Hi all, welcome to the Healthy Minds Roadshow. I'm Jackie and I'm the Principal Social Worker for Bradford District Care NHS Foundation Trust. Can I please encourage you to introduce yourself in the chat? This roadshow is an opportunity for us to show how health and care and community sector organisations, as well as the independent sector, are acting as one to meet the needs of our local communities under Bradford District and Craven Health and Care Partnership. There are other sessions that you can also book onto. I'd encourage you to view the full programme on the partnership website and the link will be included in the chat. The session will look at a pilot that we have undertaken for Bradford District and Craven on personal health budgets for mental health, which I'll explain more about when I start my presentation. We will be sharing experiences that some of you may find quite overwhelming in our session. If you do, please take a breather by muting the sound. This session will be recorded and will be added to the partnership website in the coming weeks. If you can please mute yourselves so that we don't have any background noise whilst presenting. I would encourage you to ask questions throughout the session and we will do our best to answer them as we go along or towards the end of the session. Thank you. Natasha, can we have the presentation, please? So our pilot is personal health budgets and mental health. The background to the journey started in October 2022. I attended webinars on enhancing the role of NHS social work in mental health for personalised care. The webinars presented a variety of projects where mental health, personal health budgets have been implemented to target and address a specific issue or gap in services. At the time, I was supervising 2 social workers in our inpatient flow management team, and I identified many social barriers to people leaving hospital that did not require health and social care funding. The social barriers were having a significant impact on flow back to community services as well as the individual's ongoing mental health recovery, causing delays of transfer. Learning about the mental health personal health budget was key to the development of the business case for a pilot to be done at place. Next slide, please, Natasha. The business case was put forward in April 2023 to support the Community Mental Health Transformation Programme, which will aim to transform the way mental health care and support is delivered in your local area, providing a clear commitment to trauma-informed personalised care, which is at the heart of the personal health budget. The aim of the pilot is to transform the culture in care planning, recovery-focused support work and support people to return to the community. We will now play a short clip explaining what the personal health budget pilot for mental health is. Hello, my name is Jackie Hooley. I am the Principal Social Worker for Bradford District Care NHS Foundation Trust. I am the Programme Lead for the one-off personal health budget pilot in mental health. The pilot supports people in mental health hospital to have more choice and control over how they wish to receive care and support. We work with different organisations who are part of the Bradford District and Craven Health and Care Partnership. This includes health and care and the voluntary and community sector. Our partnership has the ethos where we act as one. To help people live happy, healthy at home, there is a criteria in place to access the one-off personal health budget in mental health. It includes payments for goods and services that would promote being socially ready for discharge, helping to prevent a delayed transfer of care, bringing forward the planned discharge date or promoting recovery back to the community. The individual needs will be identified through the What Matters to Me conversation with a healthcare professional so they are able to receive personalised support. I will now hand over to Matthew Riley, our patient involvement leading on lived experience.
Hello, my name is Matthew Riley. I'm an involvement partner at Bradford District Care NHS Foundation Trust, and I've been supporting a pilot by bringing my own lived experience of accessing mental health support in Bradford. I'd like to start with highlighting some of our key achievements from our first 6 months of the pilot. On the screen, you should be seeing an infographic which highlights some of these key achievements. These are from our 6-month evaluation. This is available on the partnership website. A link to this will be shared at the end of the session. During our first 6 months, we supported 110 applicants with a personal health budget. 90% of these came from our inpatient services. During our pilot, we wanted to review the impact a personal health budget had on people returning to hospital within 28 days. This was called our readmission rate. We were able to identify that those who had applied for personal health budget had a readmission rate of 2%. This was compared to 9% for those who had not applied for personal health budget. This gave a readmission rate 4.5 times higher for those who had not applied for PHB. I'd also like to highlight how during this we supported 559 referrals into wider system support with individuals in our local communities. This was based on the information the individual highlighted as important to them during their What Matters to Me conversation. I would now like to share a short video which highlights how we included co-production throughout our pilot. Hi, my name is Matthew and I'm an involvement partner at Bradford District Care NHS Foundation Trust. Bringing in my lived experience of using mental health services, I've been able to support staff in how to structure conversations to support the individual, to begin to consider what recovery looks like for them when considering a personal health budget for mental health. This will allow us to provide the right support at the right time in the right place for them to achieve their goals. One of the key benefits of implementing the personal health budgets has been helping the person to be seen as an individual. We have health services recognise that the individual wants to engage with services they trust and work in a way complementary to them. By supporting them to access wider community support, it helps build professional relationships and helps the system understand individuals' needs. Personal health budgets have helped people believe in their own recovery. It's empowered them as they know they are being listened to and supported, so they are able to look forward to the future. It has helped build trust in their wider community and support networks. By involving people in their care, it has helped reduce the number of readmissions back into hospital. The video highlights some of the benefits of involving people and supporting co-production throughout their PHB journey. Some of the learning we found during the evaluation highlighted how working with staff to create training to support developing different communication styles influenced by a trauma-sensitive approach, supporting to improve therapeutic relationships. We supported system partners to act as one to build a shared approach to sharing positive risk management. Appropriate information sharing. This learning has influenced wider considerations with approaches taken within the community mental health transformation. And finally, by empowering individuals to be included with designing their own care and support plans. This has supported them in being able to access community support earlier, reducing and preventing crisis interventions. I would now like to refer to our PHB journey map. This should be coming on screen shortly. This highlights the different ways we involve individuals through the process. We start with involving the individual to co-produce their own What Matters to Me conversation. We also co-produce our application form in a trauma-sensitive way and which focuses on building individual strength. We also co-produce our signposting between people with lived experience, clinical and non-clinical staff, supporting our delivery partner, Bradford District and Craven Mind, to further involve and co-produce their outcome measures and their journey within their local communities after leaving hospital. I would like to highlight what is next for our pilot. We are working locally on how we can continue to offer PHBs to individuals once the pilot period ends. We are also supporting conversations both at regional NHS systems and NHS England, particularly around supporting personalised care and supporting people to leave hospital and return to their local communities. I would now like to introduce Maynaz from Bradford District and Craven Mind, who is going to explain their role in our PHB journey.
Thank you for that, Matthew. Hello, everyone. I'm Inez, one of the service managers at Bradford District and Craven Mind, and I'm excited to be here with you today to share about our mental health one-off personal health budget pilot project. This initiative has been such a meaningful experience, and I'm looking forward to walking you through how we're providing practical, tailored support for each person's unique journey. Natasha, could I please have the personal health budget journey map back on the screen? Thank you. So as delivery partners in this pilot, our role begins right after a referral is approved by our partner organisations. From that point on, it's over to us to connect with each individual and get to know them on a personal level so we can offer truly personalised support. Here's how it all works. In our first session, we sit down with each individual for a warm, open conversation. This is a space for them to freely discuss their mental health journey, and it allows us to understand what's most important to them. We also take this time to explain exactly how we'll be supporting them, whether that means helping with essential purchases or arranging services that can really make a difference in their everyday life. The second session is where things get really hands-on. Whenever possible, we actually accompany the individual to help them make these purchases. This step is essential because it allows us to ensure they're comfortable with their choices and that what they're receiving meets their needs. Our goal is to empower them with a sense of control and to make sure they feel fully supported throughout the entire process. So then, in our third session, we shift the focus towards the future. Here, we talk with each person about their long-term hopes and goals, what they want to achieve and the steps they see themselves taking to get there. This discussion allows us to explore potential opportunities to connect them with additional services or resources that might help them continue moving forward. So, this work is very rewarding. Being part of this pilot has been truly rewarding. Each request we receive is unique. Each person's story is personal. And we get to see firsthand the impact that this support has on their lives. It's incredibly fulfilling to watch as their confidence grows and they gain the tools they need to make meaningful changes. This work reminds me every day of the resilience and strength people have within them, and it's an honour to be part of their journey. I will now hand over to Hisham.
Hi everyone, my name is Hisham Al-Mahani. I'm Senior Service Manager at Bradford District and Craven Mind. So going back to the service and the commitment to deliver personalized care, placing individuals' needs and what matters to me conversation, as Matthew said, and making the service as the heart of what we do. So our approach, as Maynaz said, is about ensuring that supported, provide and tailored to unique required of each person. So what each person individually needs and tailor that to their needs and wants. While many services already exist in the community, we have to think about how we can approach these services, and we already have built this strong relationship to make sure this contacts are being made individuals with the resources that align with each individual specific needs. So for example, we had direct access to food banks, where we have supported over 25 individuals with food bank vouchers. Our staff went above and beyond, where they have delivered these vouchers directly to individuals' homes. Through our service, we have directed 104 individuals to our guideline service for additional support, and also we made 77 people aware of our safe spaces, helping to prevent hospital readmissions. To reflect also this as an example, like about support provided, and example is about when we had a third session with an individual where staff identify at 4 p.m. that person they have like a debt on their electric meter, they are diabetics, and they have no food. Actively, they went straight away into what they need to do. So they have to solve the issues and outstanding debt on their meter, provide a new key for this meter, and deliver some essential food supplies. This outcome was made possible through the strong collaboration and excellent work relationship and partnership together. I will give you just a few examples, not everything, about where we have reached in terms of the places where we have given this support. So like family hubs, we have made the refer for 50 individuals, walk and talk well-being groups for 6 individuals, creative groups 10 individuals, Maastricht hearing voices support 3 individuals, first response crisis support 22 individuals, PEEP 27 individuals, physical health like exercise and well-being 99 individuals. Our commitment to co-production and collaboration to ensure that what we can effectively meet the needs of the individual we serve. So as you can see, like we are trying to do this, and then I'm gonna hand over to Jonathan, who is our fantastic well-being practitioner who is doing the proper delivery on the ground.
Thank you, Hisham. So I'm Jonathan. I'm a wellbeing practitioner at Bradford District in Craven Mind, particularly working on the personal health budget service, but also other services. I'd just like to say before I even begin, it has been a massive pleasure. I know we've heard that a few times, that how fulfilling it is, and it's constantly fulfilling doing this job. And the kind of, by delivering the personal health budget, the kind of impact that has on the relationship we're able to develop with the client, by promoting their autonomy and stuff, is just a great thing to be a part of. But yeah, today I'm going to deliver a case study to show you what we do a little bit, and then also show you some feedback we've had across various cases we've dealt with. Yeah, so this first case study, as you can see, I was working with an individual who was struggling with anxiety, low mood, and previously had episodes of psychosis, which led him to being supported as an inpatient for some time. The individual had requested on his personal health budget for new trainers, walking shoes, headphones, and new clothing. Upon talking to this individual over the time of our intervention, it became apparent to me that he was most affected by feeling lonely, low motivation, and unhappy with his appearance. However, when I first talked to this individual, he was somewhat reserved. The conversation mainly relied on just those items. However, I tried to use a person-centered approach through active listening, positive regard, and through that we were able to build some rapport, and we were able to collaborate to get him exactly what he wanted and work with him on how we were going to use that stuff to aid his well-being. Through this collaboration, he was also able to open up to me more, and therefore we were really able to talk about his struggles with socialising, feeling lonely, and his previous struggles with episodes of psychosis. And I was able to have supportive conversations with him about this. Over the course of the intervention, this person was able to begin going on daily walks. He was actually going on walks for about 4 miles a day, which was very new to him. And it was all the way to his sister's house. So he was able to do that because of the trainers we'd provided and walking shoes, sorry. And through that, he felt like he was more socially supported. He felt like he was accomplishing his goal of exercising more and losing weight, and his mood was just boosted by getting out more. I also talked to this individual about discussing a staggered return to work. He was actually still working, which I was very supportive of and was very impressive. But he wasn't working in the office, and he felt like working home was having a negative effect on his well-being. Because he was just in the same 4 walls, as when he's relaxing as when he's working. And so I worked with him talking about how he could slowly return to work. And he was able to do that with the help of the clothing we provided, as that gave him this increased confidence. And by our final contact, this individual was very open. I mean, as you can tell from what I'm saying, we were talking about all his struggles, his well-being. We were talking about how to use the personal health budget items to help him with this. And he'd actually took the first step into going back into work, which I know meant a lot to him. And he'd pushed himself to actually talk to his colleagues. And he said that his clothing had really helped him feel more comfortable doing this and more confident. Also, by the intervention's end, he told me that he was proud of himself. And this, I knew from talking to him, was something he hadn't felt in a while. And he felt supported for our conversations to feel like this, and by going out there and him doing what he needs to do to look after his well-being. He also stated that it was due to feeling more open and the positive impact this has had. He was more open to talking to other supportive services that would inevitably help him stay well. And so I was able to make him aware of another service of Bradford District and Craven Minds, Enhanced Access, in which he'd be able to continue to have supportive conversations that would maintain his well-being and look to further signposting. He was also quite motivated to join well-being groups at the time. We talked about that too. And I also made him aware of the crisis lines to let him know there's always someone there in case he feels he needs to talk. Now that's the end of my case study, but I'd like to just go on to some feedback. If we can have the next slide, please. Yes, so I'll just quickly explain a few of these feedbacks. So the first one is actually that same individual I was just discussing. And as you can see, he was very happy, I think, by the end of it.
Oh no,
what was that, Jackie? Sorry.
Sorry, Jonathan, we lost you for a minute, but you're back.
Okay. All right. So the second one, as we're going down, the second quote, was an individual I'd recently supported who had really severe dyslexia, and this really affected his well-being and mental health. And we'd helped him get some dyslexia aid pens. That's what he'd chosen to use his personal health budget for. And this had allowed him to do things many people take for granted, such as check bus timetables, read his own bills, organise his money. And the effect this had on his well-being was huge. And as you can see, he even said it changed his life. And it really changed how he saw these services, I think, both the NHS, Bradford District and Craven Mind, and the partnership. He was really positive about it by the end, which was really nice to see. Another emotional one. They're all emotional. The third one down was from my older colleague Mandy, who is a godsend to the service. And she shared this with me. And it was the one Hisham was talking about earlier, actually. I was involved in it. It was a team collaboration to try and make sure this person could have the electricity and food he needed. But yeah, give a special shout out to Mandy because she was really out there at his house, out of hours, making that happen. And he clearly felt that had, really impacted him. And then the final piece of feedback you can see on this page was another individual Mandy supported. This individual had autism, and I think that may have affected his well-being quite a lot. And Mandy was able to develop a really strong relationship with him through talking about a special interest of his space. And he chose for his personal health budget to be used for a space projector. And that's all from me. Thank you for listening to me. And I believe we're going on to question and answers now.
Thank you, Jonathan. Thank you. Okay, so if anyone wants to know further information about this pilot, a link will be included in the chat. It includes information about why we're doing the pilot, our evaluation reports from February to July of this year. These include our key findings, interviews with patient service users who have had a personal health budget. Our pilot has been truly a partnership where we've acted as one to meet the needs of local individuals in aiding personal mental health recovery. We have had a number of partners involved, to name a few: the local authority, Bradford District Care Trust, sustainability team, various charity support, for example, Percy Bilton and In Churches, local business, domestic cleanings and Newlands Furniture. I would also like to take this opportunity to say thank you to the Healthy Minds communication team, Natasha and Nina, personal health budget team at Mind in Bradford, Matthew Riley leading on patient involvement and lived experience. Behind the scenes, we've got our Bradford District Care Foundation Trust personal health budget approval team, inpatient staff and community staff that really have supported the success of this project. We have had so many more partners who've supported us, but the list is actually endless, and apologies to anybody that I've missed. And if you would like to get in touch, please email the address. It will be added in the chat. Thank you for attending the session. We will send a link over the next few days for feedback on how today's session went. Please do fill this in so it will help us improve future sessions. And if we can move on now to any questions that you might have. Thank you. Michelle?
Hi everybody, I'm Michelle Bennett. I work for West Yorkshire ICB in the personalised care team. I love this project. I've loved it from the start. I'm a big champion of this. I just want to say thank you to all involved. You've made a massive difference. I guess really my question is for the wider group, really, in the fact that we are still struggling across West Yorkshire to get not just one-off PHBs, but PHBs for people under Section 117. And I just wondered if anybody's got any ideas on how we could do that. And maybe that's not the right question for you, but I keep asking wherever I go because I could go in Bradford and doing amazing.
And you know what, Michelle, this comes up for us as well, from wider people across the trust. My understanding is that there's it comes through like 117 comes to anything is provided through like your health and social care packages. This is a separate pilot project.
Yeah.
And I assume that mental health, learning disability, older people's all have their own area for that. So we tend to redirect them to their local area, to their local authority lead or health lead. So because personalisation isn't something new, is it? It's been around a long time. And it tends to just be big packages of care for 117 aftercare. So myself and Matthew, it probably doesn't come to the Mind staff, but we redirect it to the local area. But I know we've had all sorts like travel support for carers when people have been out of area, but we've sent it back to like I don't know if it's Diane Cotton now, but I think it's somebody else now, but we've escalated it up through our senior leaders.
Okay, thank you. I still think it's great what you've done.
Hopefully it'll go wider in the future.
Hopefully.
Okay, Nicola? Oh, sorry, Julia. Sorry.
That's all right. Just to reiterate, Michelle, I'm absolutely loving your approach and what I'm hearing today. It's phenomenal. Thank you for your presentations. I guess from my point of view, as I'm designated clinical officer for children and young people with special educational needs, and that personalisation approach is something that we're really wanting to sort of look into. Well, it's a requirement as part of the SEND Code of Practice. So I think something for me is around that decision making. So do you have a panel around the decision making and the funding, and just a little bit more about how that works?
Yeah, so it might be of interest for you to connect with Michelle, because the child and adolescent team have done a small similar pilot in Halifax. So it might be worth connecting with Michelle about this, of how they've done it, because they've with quite a small pot of money, isn't it, Michelle?
Sorry, I turned my thing off. Yeah, absolutely. The CAMS team over in Halifax have done a small project. They were given £10,000, which in the grand scheme of things is a lot of money, but isn't a lot of money. And that's been supporting children and young people going through the CAMS and the Open Mind service. But I'm more than happy to catch up with you outside of this. I'll put my email in the chat. And they do have a panel, so that when it comes to that decision making, and I know that you have a panel as well, don't you, Jackie?
Yeah.
But there is a panel that supports that. But I can put you in touch, Julia, with I can have a chat with you and put you in touch with those people from there.
Yeah, that'd be great, Michelle. Thank you. Yeah.
Julia, just to add to that, our original business plan that we put through to Healthy Minds Board, we based it, the original investment was based on offering 20 referrals a month, which I'm sure that'll bring a smile to a few people's face because they've started increasing rapidly. And the idea was that we would target mainly social barriers to people being transferred out of hospital, and that was to get the service up and running. We have around, I think, 60 people leaving hospital a month, but that would require quite a lot more resource. But although everybody who is admitted to our hospital is entitled to a personal health budget, and it was calculated that an average of £250 to £300 per person. But what we're finding is that some people might only need, say, a phone or something, what is around £70, but then we've joint funded things like house cleans and things where we've put a larger budget in, or our community rehab pathway where people have been in hospital a long time. So what we have is, behind the scenes, we have a little Teams chat where there's, I think, 10 volunteers of professionals in the trust, because it's as quick as reading an email is reading the referral, and they will put ideas and things in the chat and say, well, I agree with this, but have you thought about this? Is there a community resource? So we're using everybody's knowledge really to feedback and say, actually, do you know that this service does that? What about a starter pack from inpatient, from in churches could meet that need? So we're using our community staff and inpatient staff knowledge. So there's generally 3 of us that approve it, so that one person isn't making that decision.
Have you got anything on that pathway? Have you got like a standard operating procedure or anything? Or
because it's in the pilot, we've started writing the standard operating, but what we have got is the logic model, which we could, if you put your email address in the chat, I'll send it over to you. It's a little bit out of date now, but we had support for the original logic model, so we could share that.
That'd be really helpful, Jackie. Thank you very, very much, and thanks for today. Like I said, it's been fantastic.
Thank you. Nicola?
Hi, yeah, sort of echo what everyone says. It sounds great. I'm completely new to this sort of world, so I've got loads of questions really. One was sort of, so where does the money come from for this? Is this sort of government money that people, is that where it's coming from?
So it's come from our Healthy. I'll let Matthew sits on the board from Healthy Minds, so I'll let Matthew explain.
So it will pitch to our Healthy Minds board, which is part of the Bradford District and Craven Health and Care Partnership, and we're able to, they funded our pilot through the Mental Health Investment Fund for 2023-2024. So they gave us, I think, 200,000 for 18 months to run a pilot to support 20 people a month for 18 months, and we are due to go back to them anytime now to ask for further investment through the standards to support it going forward.
Okay, so this isn't like a thing that just happens, people get this budget, this isn't a sort of national thing that happens then, this is very much a Bradford project. Yeah,
it's one of the options of personalised care, but it's not one that we've always offered, so this was our pilot to trial it and see how we could implement it going forward.
Okay, and then is it for people who have been in hospital? Is that what, I don't understand the criteria for who can and can't get this.
So it's for anyone who's admitted to a Bradford inpatient bed or a Bradford resident who may be in and out of area bed, regardless of age. We also support anyone who has a multi-agency care plan known to Bradford NHS Mental Health Services, who have 3 people involved who may be at risk of significant deterioration or admission. So we are looking at preventing them from ending up in hospital, because a lot of those people who have multi-agency care plans, being in hospital isn't the best place for them. So anything we can do to keep them at home makes a big difference to their experience.
Brilliant, thank you.
Nicola,
and I was going to say, how much is it? But sorry.
Sorry, I was just going to say, can I just pop in there, only because I've got to leave and go to another meeting. So as programme manager for personalised care across West Yorkshire, this is what we're finding is a massive barrier to lots of these projects taking off, is that we need to try find funding from somewhere. So across West Yorkshire, lots of people would love to be able to do this, but actually it's about taking like they've done in Bradford, a really robust pilot plan to say this is what we want to do and we want to, but it's a massive barrier across West Yorkshire. People say we'd love to do it, but we haven't got the money, or it's been done in different ways. So it might not be called a personal health budget. It might be called like discharge initiatives or things like that. So I just wanted to add that in there, but I really have to shoot. So apologies for interrupting there.
That was useful to know.
Nicola, I've added in the chat the NHS Futures page because there's lots. This came about for me through NHS England and raising the profile of NHS social work. That's how I came involved with my networks. But the actual NHS Future page, there's loads of information of different projects up and down the country, of how they've started, how they've put forward a business plan, because it's local areas looking at local problems and designing something. So we took some of the learning from some of these projects and then we designed it over what we saw as a problem in Bradford. So it's worth having. There's lots of information and resources on the NHS Futures page, and it's worth having a look. But then it needs somebody to take a lead and write a business plan, put it forward to board, ask for some money, and then it takes a journey of itself. So I think it requires some leadership to kind of advocate for it. But there's some really good information on the implementation framework resources, and there's lots of people's initiatives, what they've designed things around their local services.
Okay, I'll see if I can log into that and have a look. Lovely. And then the last thing was, when you say social barriers, what do you mean by social barriers?
Okay. So social barriers, what I noticed when I was supporting the social workers in the flow team was that some delays of people leaving hospital were down to like health and social care funding packages of care, but actually there was a lot of issues with people's homes not being habitable, what had been identified on admission, and they couldn't return home because things had happened leading up to the mental health admission. Things like white goods, for example. We had a gentleman who had a psychotic episode. He was one of the early applications, and he put all his white goods outside in his garden in the bad weather, and they were either damaged or stolen. So as he recovered his mental health journey, he realised that he had no white goods to return home to. So we were able to get them delivered next day delivery so he could return home from hospital. Lots of people leave hospital without a phone. So I think, I can't remember the last update, but it was about 17 phones. Well, if you haven't got a phone, you haven't got any opportunity to engage in services leaving hospital. And we're required to have a 3-day follow-up, a 7-day follow-up with services, and then transfer back to your community team. If you haven't got a phone, that makes it very difficult. So there's your social barrier. But there's been many different things that have prevented people from leaving hospital. There's a lot, in fact, a lot of them are listed in the evaluation.
Thank you.
Kalsoom?
Yeah, hi. Yeah, great service. Just want to ask, this is a pilot and it comes to an end. What are the chances that you're getting some more money to kind of carry it on? And you must have shown quite a lot of savings in this. Is that going to be in the evaluation? I mean, what kind of savings have you roughly kind of saved?
I mean, we've just looked at October, and I think we were up to. I'll let Matthew answer it actually, because he's done the evaluation.
And say in July, we'd supported 288 days earlier discharges from people leaving hospital, and at around 250,000 financially saved. I think in end of October we'd reached 430,000 financially saved. We would save on top of that because our readmission rate is lower, so we're preventing people going back into hospital there. But at the moment, we're not able to calculate that. On the screen there is our journey up to July. So we supported 288 days across those 110 applications, which were 227,000 financially. It is due to go to board, I think, on the 13th of December, asking to support reinvestment through the mental health investment standard. So we're quite confident we will get funding. It's just if it allows us to expand to provide more than 20 a month.
I've got another question. You know, when the person gets a personal health budget, so when they come out of hospital, are they referred to Mind, and how do they actually get this personal health budget then?
So there's different ways you can have personal health budget. Our pilot, we've gone with direct budgets. So that is in that approach, Mind purchase the item and provide that to the individual themselves. So generally we can provide it while they're still in hospital, so they have it before they leave. For certain other items, so when people wanted washing machines, we'll purchase that once they're back at home. But if it's something what can help soothe them or aid them while they're in hospital, we do try to provide it while they're still there, and it helps build that trust both with their inpatient staff, but also then starts building it with their wider community team again.
Thank you.
Does Maynaz or Hisham want to say anything about, I think Hisham, you already covered the amount of increase in other areas to Mind, and even before it gets to Mind, what we're picking up from the What Matters to Me conversation, it's 6 questions. I don't know if we could get the questions on the screen now. It might be a bit too much. I don't know if you've got them there, Matthew, but what we find is people in that conversation are identifying they'd like to get back into employment or education or hobbies and aspirations, and we're doing quite a lot of additional signposting before it even arrives with Mind. So we're saying to our care coordinators, somebody's identified they'd like to go walking again, or they'd like to start fishing again, and we're identifying these things through the conversation. So there's lots of signposting to community resources on both sides, on the health BDCT side and also on when it arrives in Mind and the wider services. And also when Jonathan, Samina and Mandy go out to see the person, they might pick up even more in that intervention of other things that people are interested in. So just to give you an example, these are the questions. Can you see them on screen? So it's a very simple application. But it actually develops a little bit of a care plan in itself.
So a copy of our application form is on the link what was shared to the partnership website. It is in one of the appendices for report C.
Nicola?
Yeah, it's just interesting when you were saying there about kind of going walking or fishing or what have you. How do you find out about sort of local kind of community services like that?
So Matthew is like the oracle, and he seems to know a lot about community services. Lots of local things like Treacle Me have a really good website. The local authority, our trust have a Better Lives website. Generally a bit of Google as well, and seeing what's out there and what's looking at where that person lives and what might be close to them. So making sure they're connected locally and not needing to travel, and seeing what's available.
Yeah, lovely. I just didn't know whether you like linked into things like social prescribers, whether they were able to support you with this or not.
Our Treacle Me is linked into their website is social prescribing.
Yeah.
We do link in with our GPs and their community partnerships, so we do find out locally what's going on in people's areas, and we can then use that as our recommending approach.
Brilliant.
Hisham?
Just like to comment on what you said about how we are using like services. So like I go back to the same example like we mentioned about the gentleman who is diabetic and have no electricity at home. Now he is referred to another service called Smile, which like it's a further support. So not only like 3 sessions, then he will be discharged. The whole idea is to make sure that the person gets healthier and have this quality of life, and not needs to go back to hospital and readmitted. So how we can do it in the way. So we're not gonna say, yeah, off you go, you have this item, We have done it for you, and that's it. We are like more in, and that's why I think it's close to everybody, and you can see everybody smiling when we talk about personal health budget, and everybody when we talk about it, people like it. It's just because that we try to have this human element there, that we care. If you think about it, Mandy, when she picked up that call at 4 o'clock, and she stayed, I think, around 7:30 in the evening, and Matthew tried to also to get the electric key to make sure that to clear that debt from. So if you think about it in real life, like if you go to more business corporate settings, you will not find anybody willing to do that unless their manager forced them to do that. However, I didn't even try to speak to Mandy or like John, anybody, and they have done it themselves to say, we just knew where, I think our WhatsApp team, sorry, not WhatsApp, sorry, the team group where people start asking, and everybody suddenly, Jackie, Matthew, Menaz, Jonathan, Mandy, Claire, everybody started to engage on how they can help. So I think this is like everybody, it's close to their heart. And at the end of the day, we are human. We like to help people, and we need to make sure that this is reflect really positively. So on the second hand of what you asked Nicola about the services, our like practitioners are really trained, and they try to search really about what's the best for the person. So like Matthew said, is it the GP? We make sure that we don't have duplication services, that he doesn't already access something. We are duplicating that was another service. So lots of research, and we also we have like a database, and we are using our Healthy Minds website, because there's lots of information on the Healthy Mind website that we always encourage our practitioners to use it. And if there's nothing, like there's a service that we find out, we always try to share this information with Healthy Mind to be added on the service, so we have up-to-date information on the Healthy Mind website. I hope I answered this, like what you asked me for, Jackie.
Perfect, Hisham, perfect. And I'm glad you gave Healthy Minds website a shout out. Thank you. Be good for us to put the link in the chat. Has anybody else got any more questions? I think we're nearly at our hour anyway. Okay, well, thank you all for attending.